Good morning. My name is Dr. Chiraag Kotecha, for those of you who don't know me. I'm here to talk about something very serious that I've talked to several of you about over the last couple of weeks. Now, the issue we were talking about before was how to prevent coronavirus coming into Uganda. Now it's here. You've all been following the news and people have been receiving lots of articles. So at the request of Mr. Sanjeev Patel and the Indian Association of Uganda, I've put together this video for your understanding. So, coronavirus, as all of you know, it arose out of China and has spread over the world. When we talked last, we had about 100,000 cases. Now it's over 400,000 cases, and this will just double every day. We had a scenario where the first 100,000 patients took 67 days to develop, and the number of days for every 100,000 thereafter has become less and less. It is spreading fast, leading to shutdown of countries, impacts on economy, but most importantly on human life. So, all the symptoms that you've heard about, we've been talking about: fever, cough, shortness of breath, which are important. Fever is usually the main one, and cough, shortness of breath in extreme cases requiring hospitalization. Given our change in weather right now, with the rains and everything, we have people complaining, and I get a lot of calls saying I'm sneezing, I've got a runny nose. Now, these are rare in coronavirus, or patients affected with COVID19, as is the official word. But there can also be in upper respiratory tract infections, such as the common cold and flu. So that is usually the presenting symptom for the normal cold, cough and cold people have. We get a lot of calls as to what do we do. What we've been advised is please do not immediately present yourself to the hospital. It will spread to the sick and vulnerable patients, people who are elderly, and I'll explain that in a moment. It is recommended that you stay at home, take simple measures of lots of fluids, paracetamol, take lots of rest, and keep yourself away from other people if possible. There are emergency numbers here written down: 0800 0800 203 033 or 0800 100 066. These are Ministry of Health numbers that you should call if you suspect that you or anybody else has coronavirus. People say that the phones are unanswered. The ministry or the representatives are very busy. They're trying to control a pandemic in the country, which nobody internationally was even prepared about. So you need to be careful, be patient. They will answer to you. Please take care. Do not go into hospitals, again I say, unless absolutely necessary. We as the Indian Association are constantly engaging the KCCA and the Ministry of Health. Mr. Sanjeev and myself have been appointed to the National Task Force, and will update you. We have created teams with several other people on board to advise you a bit more. So, now that we've talked about what if you think you have it and what coronavirus is, why is it important that we don't go to the hospital? Now, first of all, 80% of people that get infected will recover. You will get better with a mild illness. It is the 20% of people that will be very unwell. The 20% of people that will be unwell, out of which 15% of them will need hospitalization, oxygen through the nasal cannula, supportive measures in there. 5% will need intensive care therapy. Now, this is where we come to the concept of social isolation, because if it was like any other sickness and we could manage with 5% of the sickness coming into ICU, healthcare systems worldwide, even Uganda, we could be able to manage. However, it is the rate at which the people will present to hospital that will cause a big problem. So if I was to draw a simple graph on how to do it, say you've got one person, say myself, I don't know that I've got coronavirus. I will infect 1 or 2 or 3 other people. Now these 3 people, in effect, within 14 days, 7 to 14 days, will go on and infect another 3 or 5, and so on and so forth. So what we'll see, this will go into 3, this will go into 3, this will go into 3. Now people that go into ICU will require supportive measures through oxygen, through ventilators, and how long do you keep them on for on the ventilator? So the thing is that if you draw the graph, which a lot of you will have seen on the internet and social media, is how this impacts the world. So it starts off with 1, 2, 4 cases, and it builds up, and suddenly you've got this exponential increase which is at this stage where many people are starting to infect other people. It gets to a peak and then comes down again as people recover. If I was to draw another line here, this is the capability of a healthcare system. Every healthcare system in the world has their own lines. So the point is that these people, the too many people that are presenting to the hospital, will cause a big burden on the healthcare system, hence the mortality rate. The mortality rate is the death rate. Currently, younger people, it is very negligible. But as you get older, the death rate goes up to even 14-15% for the people over the age of 70. What we need, us health professionals, need your support to stay at home. If you can stay at home, you have the privilege of not working or working from home, sending your house staff or your helpers home so they can also be away from this impact. They can take care of their families, not use public transport to come to you, will help reduce this cycle. So for example, if I was to infect 3 people and this was one of my house staff and I sent her home, so she's not available, so automatically this line kicks off so that you got fewer people infected. This person I've been in touch with one, say Mr. Sanjeev, sorry Sanjeev, I'm using your name. I infect you with coronavirus. Now you go away and take care, or you don't take care, for example, and you go on and infect 3 other people. However, this person who is here, maybe Jayshri, let's say, is very sensible and says, Sanjeev, let me stay at home and isolate myself. So she will stop this part of it. So we'll break that chain there. If many people, or the more people that take responsibility through this cycle, will reduce the number of patients, this quite abrupt increase, leading to what we call a lower flattened curve, whereby the number of cases in A, the top graph, and the bottom graph will be the same. We'll have equal number of people infected over time, but this will be a bit longer. What this will help is that your healthcare system in your country, in this case Uganda, it will help the healthcare system manage the burden of the disease, thereby reducing the mortality or the death rate. So this is what we request our community to do, our people to do. Educate your staff, educate your friends and colleagues, and spread this around, message around. Any more clarification, team numbers will be communicated. You've got the Ministry of Health numbers, but what can you do in addition to isolation? You've heard the simple measures which Our Excellency the President announced about hand washing. Use soap and water is just as effective as tap water, as sanitizer. Use precaution when you're coughing, sneezing. Keep away from infectious contacts. Cough and sneeze into the elbow of your arm. Do not go and shake hands with your elbow or elbow bump, because that will also help spread the virus. Rather, keep a distance of 4 meters as requested by him. Work from home if possible. The key word at this stage is social isolation. We're at the start of this disease in Uganda. It will only increase if we don't take precautions, and we urge the community to take all these measures. Most importantly, self-isolation. Again, myself is Dr. Chiraag Kotecha. Please share this video. God bless you and God bless Uganda.